United States. Respected teachers, professors, and the researchers, my topic was pharmaceutical incentives and medical ethics, attitude of future doctors, that means medical students of Bangladesh. And actually I have defended my thesis. This is the short form of my thesis as PowerPoint. So let me introduce you with the title of my presentation. That it is well known that pharmaceutical companies offer various gifts and incentives to the doctors and sometimes to the medical students. But do we think about the gifts? What are the advantages and positive aspects of this collaboration? Of course, this collaboration has some kind of positive aspects and some negative aspects. And what are the negative aspects are? And are the doctors really influenced? Does the influence affect prescribing proper drugs for the patients, or somehow they are being manipulated by the gifts? Can this interaction lead to a biased decision for therapy? These are the questions that has been rolling in my mind for years. Then I decided to go through research study. And some other questions are, in which limit are this interaction ethically and lawfully approved? Is receiving incentives ethically justified? When does it fall into criteria or bribe or kickback? What are the doctors' view regarding this issue? Are they aware of the guidelines of this concept? There are various guidelines in many countries. Some are international guidelines, some are national guidelines for the corresponding doctors. But are the doctors aware of it? Are they trained about the guidelines? Are the medical students concerned about the guidelines in the medical school? All these questions are knocking the mind of the scholars for many years. Then I have been doing the thesis for 3 to 4 months in this year, and I'm just now presenting the summary of my thesis. The general objective or the research question of my thesis was to explore the attitude of future doctors regarding the incentives offered by the pharmaceutical companies in Bangladesh. And specifically, I wanted to know the demographic data, exposure, and experience about pharmaceuticals, to determine the attitude of medical students to pharmaceutical companies, to evaluate the attitude of medical students to drug companies and drug representatives that visit the doctors and medical students few times, to find out the correlation, associated factors, the factors that affect the attitude of medical students to prescribe the drugs or their somehow overall mentality towards this issue. To compare the results with different other countries in the literature. So here is the methodology of my study. The study type was correlation, cross-sectional and correlational type of study. My methodology is presented in just one slide so that I can be more focused on the results. Independent variables, the demographics were the independent variables, and dependently the variables were attitude toward the pharmaceutical companies and attitude toward gifts and incentives. The population were third year, fourth year, and fifth year medical students, because from the third year the clinical year starts. So I just included the clinical year students. Sample size was 435. And I interpreted the attitude of medical students toward the gifts and the representatives from the drug companies by Likert scale, 5 level Likert scale, and the data analysis was done as PSS 21 version, correlation analysis by Pearson chi-square test, and p-value less than 0.05 was considered significant. In case of ethical value, double informed consent has been taken. One was verbal ethical consent and another was written ethical consent before taking the data from them by a questionnaire. IRB approval was taken from University, IRB, American University of Sovereign Nations, United States. So I'm going into the summary. I'm not presenting any graphs, I'm just going directly the summary of the results. The summary is what I found in Bangladesh from the perspective of Bangladesh. That is the main part of my presentation. Monthly parental income was between 20,000 to 50,000 for Bangladeshi medical students. That is the parental income level. In that case, it can be considered as moderate level of income, and the family can be considered as middle class family. And very few medical students had a physician and pharmacist parent, less than 16% together. So as per I remember, physician parents had 9% to 10% and 5 to 6% had pharmacist parents. Both together constituted 16%. More than half of medical students did not know about pharmaceutical representative personally. They had no personal interaction with any pharmaceutical representative, though they were in clinical years, 3rd year, 4th year and 5th year. Most of the students, I shown the percentage, 88.7%, were taught about medical ethics in medical school, because our medical curriculum includes medical ethics in the forensic medicine that is being taught now in 3rd year and 4th year in the medical schools as a part of the MBBS curriculum. But though they were being taught about the medical ethics, they were totally unaware about the physician and pharmacist collaboration. So as far I can gauge that the physician pharmacist collaboration was not in the curriculum of medical ethics. Most of the medical students did not have any experience of interaction with pharmaceutical representatives. So it is clear that the pharmaceutical representatives mainly target the doctors, not the medical students here. So though they are in clinical phase, 3rd year, 4th year, 5th year, I have found from the literature review that the pharmaceutical representatives and drug representatives have interaction with the medical students in United States, Canada and Australia, Japan, Korea, but in case of Bangladesh, they are not too much friendly or too much familiar with the medical students for their policy. So again, I found that receiving gifts by physician cause increased drug prices. So it is the attitude of medical students that most of the medical students think that receiving gifts by physician cause increase of drug prices. That's their perspective. Drug companies act unethically in promoting their products. That is not accepted by all the students, but about 60 to 65 students agreed that drug companies have some unethical policy for their promotion. Drug companies should be accountable to patients for drugs provided by them. Because the drug is being advertised to the doctors and the patients, so they should be accountable. And most of the students think so. The students should not have any interaction with drug companies in medical schools, but the drug companies can sponsor medical programs and some CME, continued medical education, and other cultural activities in the medical school if they want so. That's what the most of the medical students think. If a drug company agrees to pay for printing all cost of the medical school classes, class notes, so then the logos of that company appearing in the bottom of the first slide, like this is a PowerPoint slide. If a drug company sponsored this PowerPoint slide, or my expenses to this seminar, or the participants' expenses to this seminar, the logo of that company can be appeared in the first slide of this presentation. It is acceptable to most of the medical students. Again, I am just showing the statements that have been accepted by most of the medical students. So the rest of the statements are drug companies should not assist student tuition fees. So most of the students think that drug companies, though they are assisting now or somehow assisting in some of the months of the year, they should not assist student tuition fees. And most of the students think that it's somehow mandatory or compulsory to be introduced with trade names of the drugs. So the drug companies introduce their new products to the new doctors, interns, or the old senior doctors. But if the doctor and senior persons, senior medical professional write the same drug that has been introduced recently, he has to consider the other things associated with the patient. Is that drug is totally applicable for the patient from all aspects? Is it totally indicated for the patient? So he or she should not be influenced by the mouth-watering advertisements of the drug companies. So that's why I asked most of the medical students, will they be influenced by the advertisements? So they agreed that they would not choose a drug based on given incentives or gifts from a bunch of the drugs of same therapeutic efficacy. And most of the students thought that there is a need of guidance. Though there is a guidance, most of them are unaware. We can see from this statement that they are unaware, that's why they demand a guidance about relationship of pharmaceuticals and physicians in the undergraduate medical curriculum. And most of the students they agree in this matter that pharmaceuticals are primarily interested in profit. It's very universal truth, but somehow they still think that they still try to work the best interest of the doctors and the patients. Though they are interested in profit, their overall work and policy does not break the welfare of the patients or the doctors. So the above statements are based on the most of the medical students, the agreement of the most of the medical students. Then I did some statistical correlation and found some hypotheses and found how these attitudes and the mentality of the medical students toward the drug companies and the gifts and incentives affected. Then my next slide goes here. Result of the correlation. Association is present. You can see them in the center there is a gender, and above there is the experience about pharmaceuticals, attitude toward pharmaceutical gifts, and attitude toward drug companies. Both three factors are affected by the gender. That means if the person is not male or female, the gender affects their behavior quite very well. As far as you remember that male students had more experience than the female students about the pharmaceuticals, and female students accepted less gifts than the male students, and attitude were judged by 14 statements, and statements and their attitude towards it was variable for male and female. My next slide goes here. The academic year is independent variable, parental income, physician, parents. Both three independent variables affect the dependent variable, attitude toward drug companies. So here I can say individually that academic year affects attitude toward drug companies, parental income affect attitude toward drug companies, and physician parents affect attitude toward drug companies. In the opposite side, you can see that attitude toward pharmaceutical gifts. Academic year affects their attitude or their opinion about the pharmaceutical gifts, whether this gift is acceptable for the medical students and doctors or it is not. Their parental income also affect the attitude toward the pharmaceutical gifts. I have sorted out some 16 to 18 gifts in the question year and asked about their opinion on the gifts, and the opinion was varied according to their parental income. And their physician parents, their opinion on the opinion of the gifts were also affected by having physician parents or not having physician parents. The association is present Another slide. Personally knowing medical representative significantly affect their opinions on pharmaceutical gifts. And another association is formal teaching on physician-pharmacist interaction, as some of the students admitted their curriculum in their medical school had a formal teaching on physician-pharmacist interaction. So in the statistical correlation, I found that formal teaching on physician-pharmacist interaction somehow affected the attitude toward drug companies. As it's universal truth that education should have an effect on the mental attitude, and it had its regular attitude on the students. But association, though I tried to find out some association, there was an association between academic year and attitude toward drug companies. So there was no association between the academic year of study and attitude toward pharmaceuticals of the medical students. Another no association factor is personally knowing medical representative did not affect attitude toward drug companies. So if a medical student know a drug representative and another medical student does not know a drug representative, their attitude does not vary that much. Teaching on physician-pharmacist interaction does not affect opinion on specific gifts and insectives. I showed in the previous slide that teaching on pharmaceutical interaction affects their attitude toward drug companies, but not the opinion on gifts. Okay, I'm going to do my conclusion. The interaction between physician and pharmaceutical producers is running for centuries, as you know that. Both positive and negative outcome counterbalance each other in collaboration. But sometimes, question of ethics and conflicts of interest create debates. Pharmaceutical companies offer various gifts to physicians that can be low price, high price, that can be variable to family things or the office materials. Gifts on one side help to remember the names of the new production companies, and it is very much essential because if the new drugs is not introduced to the doctors cannot prescribe the trade name, and if he or she does not prescribe the trade name and instead he prescribes the generic name, it will be a problem for the shopkeeper or the pharmacist in the medicine shop to choose the drug for the patient. So on the other side, it may cause a selection bias of the physician's prescription. Physician may select a drug that has been introduced to him. So like other countries, Bangladesh does not present a different scenario. I had a gross literature review. I found the same scenario in the UK, in the USA, in the Germany, Denmark, Japan, Korea, and many other countries. And the Korea and Japan had a very rigorous movement about it for decades, about in the last century. In Bangladesh, drug samples, textbooks, stethoscope, pen, notepad, hospital, just see specifically the gifts names. Those are more appreciated by the medical student and doctors. That's drug samples, textbooks, stethoscope, pen, notepad, hospital kit, conference, travel and registration fees. This is acceptable to the medical students and they think that this is ethical because they are related to academic issues. The choices are different in some countries. I had in my thesis there's every details of many other countries in the literature review, and in my thesis it had been compared with other countries, other scenario of other countries. But in short, I did not mention it in this slide. But in short, I can conclude that meals and festival gifts become more inappropriate as the academic year advances. That means the final year students dislike more the meals and festival than the first year student. Maybe due to an increase in professionalism, as in general sense it comes in mind. Parental income greatly affects the attitude towards gifts. The students with low parental income appreciate computer exercise and low cost gifts. The choices can have a link to their financial problem. It also by a general sense. But because the more parental income grows, the more inappropriateness of low cost gift increases. Having a physician parents also affect the attitude towards the gifts considerably, making them more neutral. I showed them in the result section that the physician parents affect the attitude toward gifts. And what was the impact? They do some neutralization of the attitude. And moreover, personally knowing a representative affects the choice of the gifts too. It is surprising that teaching of pharmaceutical does not have any association with gift choice, but it has an association with the attitude. The reasons behind this is not investigated in the thesis, but it should be investigated in the later researches. Now what I recommend. There is several slides about the recommendation. I did not shorten any of the recommendation because the recommendation is very much important here. I recommended for the medical students that they should learn about the ethical aspects of pharmaceutical gifts. The financial problem should be balanced with the acceptance of pharmaceutical gifts. Drug samples, pen notepad, these are the things that they accepted in their sense. But I recommend that they can accept it, but it should be in a certain limit. Medical schools can determine the limit. It should be depend on the medical school curriculum or their teaching. The students can accept hospital trips, conference registration fees, and financial assistance from pharmaceuticals within a certain limit if they are in financial crisis. And sometimes students can debate that I am in financial crisis, that's why I need I need personally the assistance. We cannot oppose him. But he should disagree to write the biased prescription depending on the gift in the future. Medical schools should form guidelines on pharmaceutical gifts. There can be guidelines internationally or nationally. But there should be specific guidelines for the medical students from the medical schools they are studying in. And they should be introduced by medical schools to the source of drug information, where they can find it, where they can find the trade names instead of the drug representatives. And students should also evaluate the positive and negative aspects. They have the moral, ethical value. They can understand themselves, so they should use it. They should use their moral teaching about the ethical and negative aspects. And medical schools, according to their curriculum, they are going to form. They should train accordingly the students, so that the students are well trained and they can handle the issue in the future. And if the medical students attend any seminar sponsored by the drug companies, they should only take the educational part of the seminar, as I recommended, not the whole advertised things. They will look in the advertisement, but they will not be motivated so much by the advertisements that their future prescription can be biased. And students should interact with more patients and clinical wards so that they can know the financial crisis of the patients. They can know why the patients are being more in problem because of the high rise of the drug prices. And I have some more recommendations for the students. I'm going into the next slide directly. I had suggested some topics to be included in the medical school curriculum, as I found that the curriculum includes medical ethics but does not include the policies of interaction between the physician and pharmacist. So what should be the inclusion in the curriculum? Ethics of physician and pharmacist interaction, national and international guidelines, because the students are not introduced with the national international guidelines of the physician-pharmacist interaction, they should be introduced with it. Ethics of drug prescribing, it should be in the medical undergraduate curriculum. Physician for patient and physician pharmacist-patient relationship. Physician-patient relationship is included in the curriculum already, and they are thoroughly studied. But pharmacist-physician relationship should also be introduced a little bit to the medical student, because they have to interact with both of the group. Limits and effects of receiving pharmaceutical gifts. What are the limits and what will be the effect if they accept the pharmaceutical gifts? I have found that there are many history pharmaceutical reform in many countries, and students and doctors should know that what is the history of pharmaceutical reform, mainly in the Korea and in Japan, and somehow in the USA also. There have been so many policies and so many amendments of policies about this issue, year by years, decades by decades. So students and doctors should be introduced to it. And current policies, marketing strategy of the pharmaceuticals, and ethics of the pharmacist. A little bit, because medical students should know their ethics mainly. Difference in ethics for medical student and physician. When he is a medical student, what are the main ethics for him? And when he will be a doctor, what will be the change in that ethics? Effect of prescribing on medicinal prices. And I have some recommendation for the physicians. I'm skipping to the last slide. Recommendation from the pharmaceuticals. I have more details recommendation in my thesis. And recommendation from the government, I am reading that the government should establish an ethical body to maintain the ethics in the health system. The ethical body, the centralized ethical body, can maintain all issues nationally, including physician-pharmacist collaboration. And pharmaceuticals should report their annual activities to the ethical board, national ethical board. A national guideline in this issue is needed to be structured, which is already structured, but it should be more improvised and more introduced to the general people and public. Guidelines on ethics of receiving pharmaceutical gifts and interaction should be more clarified to the general students, who from the first year to final year students. The government can train teachers and faculties of medical schools in this issue, so that they can pass it on to the medical students. The national ethical body that I proposed in the first line can establish ethical monitoring boards in different hospitals to maintain a minimal ethical standard in that hospital and the medical practice area. That I have proposed a bit, and the more details is in my thesis. Thank you for now.
Thank you very much.
Wait, I want to see the recommendation for pharmacies,
Okay.
pharmaceutical companies. You skip it, but
For the last time, I did not
but
show.
this is very important. No. This
Okay. Pharmaceuticals should promote their products within the ethical limit. There is an ethical limit of promotion. Business promotion has an ethical standard. Sometimes they maintain it, sometimes they don't. But they should maintain it, and it should be monitored by a body. New drugs with same therapeutic efficacy should not be marketed for better business. There is a ill practice, not in our country, it's not reported, but in some countries, it's not, as it is not reported, it's just a case. If it is present there, that suppose drug A is available in the market, some pharmaceutical company produce drug B which is the same therapeutic efficacy of the drug B, A. But they again published a drug and market it, saying that drug B is the better than drug A. So drug A already popular, and drug B is going to be more popular, and there should be some financial profit for them. Yes, sir.
Okay. Regarding pharmaceutical promotion, here is a few population. We have been given this pen of an industry sponsored pen. Okay, everybody received this pen. Although we paid 500 ringgit to attend this workshop, and because of my profile of nature of work, I come to know this workshop is sponsored by Professor Negara Council of Malaysia. So some amount of money also received for this workshop, Perdana and AUSN University. Even then, they take a sponsored gift. First question, who paid for this pen? If you go to a shop to buy this pen, it will cost, say, 10 ringgit. Who paid it? Who paid it? Our friends, our colleagues, our cousins, our relatives, our own blood, they paid this industry. Industry didn't give Perdana University this pen actually free. They actually maximize their profit. So now if you do a study, how many practicing doctors are using their own pen? We'll see a few. Till he became a doctor, their father and parent can buy the pen. But when he became a doctor, he never buy the pen. Okay? He never buy the stethoscope. Okay. Okay. Let me finish. So, a doctor became like a policeman who take bribe openly from the truck driver. Here we have seen these photos. Is taken these things. Till Bill Clinton is in power in USA there was no law how much a doctor can receive a gift. A doctor has received a gift as one diamond as a paperweight. 30 years back, it cost 30,000 US dollar. Okay? You go to many maximum workshop is sponsored by the industry. Okay, Mark Sharpendam knows rofecoxib is killing people much before they withdraw, at least 2 years. At least 2 years. By this time, a lot of people passed away, but they keep the medicine in the market another 2 years and maximize their profit. Okay? In these 2 years, they appointed a number of postdoctors throughout the world and they published in a very high profile journal. Later FBI discovered none of these articles were come from their computer. It come from Mark Sharpendam computer. Okay, these are so in Bangladesh, regarding his last example, because I am a pharmacology professor, omeprazole, if you go to any market who are doctor, you will understand there are at least 15 to 16 types of proton pump inhibitor in the market. What is the benefit of having Me Too drug? They are exactly same drug, same molecule, very little side change. There is no advantage in pharmacodynamics. When the new drug comes, they always hide two things, what the cost of the medication will increase and at the adverse effects. So it happens. So there is a study in USA that medical students feel if a politician take a $50 gift, it's unethical. But doctor receiving a very luxury trip, conference with a luxury trip in a very resort area is legal. So this is, we are eating, you know crow, everybody know, Bangladeshi people know crow. Crow do not eat crow's meat, but doctor eats human meat. This is true throughout the world. Okay, I was asking him, this young man, he said, if I am working still in Bangladesh, he would be my student. Okay, are you not physically threatened? This type of research, if you conduct many countries, you will be physically threatened, not including Malaysia. One of my former vice chancellor was telling, this is how I understand why Malaysian GPs all having Mercedes and Audi. So underhand deal is a very common thing in medical faculties. This throughout the world is existing same thing. Excepting a few countries like Australia, they have a very strict law. Some Scandinavian countries have a very strict law, so you actually cannot promote these type of strokes and cannot receive gift. In Bangladesh, you can receive anything from human being, I don't want to detail, very bad thing, to anything. I know one doctor say, my daughter loves rose flower. The other day, industry bring one big lorry full of just bloomed rose flower, say 100 pots. One other day, he asked her, my younger boy loves German Shepherd dogs. German Shepherd puppies in Bangladesh is no less than 30,000-40,000 bataka. They bring dog. Everything. And this is not only Bangladesh, all over the world. All over the world. So this is actually, we need to teach our students, medical students, what quality of life. What is quality of life? What is quality? Okay. Honesty, sincerity, or very luxurious life? Thank you.
Thank you.
Thank you.
Tonmoy, any comments?
Any more comments or questions?
This type of corruption.
Actually, at first it should be considered as corruption, because always it is not a corruption when it goes beyond the ethical limit, when it goes
No.
like
This is always corruption. You cannot receive this pen. You cannot. I paid for the conference, but they take free from pharmaceutical. This is cannot. Who paid the lunch? We are eating lunch. Who paid it? Who paid it? This is we cannot eat. I'm not a baker. This is from the rock bottom is corruption.
You know, just a point. Okay, that's only ball pen. But one ethical issue that I would like to share is companies, especially foreign companies, they go, for example, to the Philippines, they provide free medicines, but these medicines are still for study, and they are being provided to the IT community,
This is
which is
corruption,
unethical.
not at the level of corruption. This is the level beyond corruption.
Yes.
Without any ethical approval,
Yeah.
they do study. Okay,
That is a major concern in the
I get
Philippines.
little bit excited. In Bangladesh, they were trying, one Swedish industry were doing a one research on oral cholera vaccine. They give the medicine even to the pregnant woman. This Swedish scientist was asked how to exclude. He answered, he is so audacity, he has so much of audacity, work visually. He visually screened out who is pregnant, who is not pregnant.
Yeah, that's also another ethical issue.
Visually. So this has been stopped in Bangladesh. It's not so easy now in my country at least.
Because I think, sir, with the ball pen, sometimes the
No,
organizer
ball pen
asks
is a
for
minor thing.
yeah.
Minor
Yeah,
thing.
as for
But
some
why
sponsors.
you will give this thing? Why we will receive this thing? Why?
Because the organizer asks for sponsorship for the registration kit. That's why, sometimes they give ball pen or they give stationery.
Oh no, you go to IMU, they never take the, I went to IMU's at least 5 times of conference, never give this type of pen. You take conference fees.
Okay, last comment, Tonmoy.
Yes, okay. I just want to respond to the question he asked, that the government should have some policy. I recommended in the last slide that parallel to the ethical body, as also though there is some ethical guidelines of this issue, so there should be some specific ethical formulas, a specific ethical limit of interaction that can be permitted legally, ethically, morally, and socially.
Okay, thank you very much, Tonmoy.
Except